Eye symptoms are remarkably common. The good news is that the vast majority of them, A, aren't anything to worry about, and B, do settle down on their own. But it is important to know what symptoms you should look out for, because there are some symptoms which are warning signs of a condition that could be eyesight threatening if you don't get them treated. One of the most common eye problems is conjunctivitis, otherwise known as pink eye, and your eye is just that. It's pink. It's the white of your eye that becomes pink and possibly sore. Now, you may find that when you blink, you have a little bit, first thing in the morning, for instance, of smearing. But actually, if you then blink your eyes away, you can see properly, so you don't have any changes in the vision. A stye is an infection of usually a hair follicle on the upper or the lower lid. See a pharmacist, but actually no treatment is needed. A chalazion is another inflammation of the eyelid, but it's not an infection. That's a cyst inside a gland called the meibomian gland. Again, with all of those three, you'll get swelling of the eyelid in some cases, not always in conjunctivitis, but your eye itself is not affected, it's not painful, and your eyesight isn't affected. A bleed just underneath your conjunctiva, that's the surface of the white of your eye, is called a subconjunctival hemorrhage. It looks really impressive, it's bright red, but it's completely painless. It happens all of a sudden, and actually, although it looks impressive, it usually settles on its own and is nothing of concern, unless you've had any trauma, in which case you must get it checked out. Now, a gradual reduction in vision can be for all sorts of reasons, including, I'm afraid, getting older, but also things like cataract. So go and see your optician about that. There are some things, though, that you do need urgent help for. Flashes and floaters, that's things floating across your visual field. They could be early symptoms of retinal detachment and must be checked out urgently. Acute pain in your eye rather than your eyelid, and a red rather than pink eye, especially if you've got blurring of your vision or halos around your eyesight or any reduction in ability to see, are absolutely medical emergencies. They must be checked out. Also, a sudden veil coming down, so you get a sudden loss of vision on one eye, or any sudden loss of vision, is a medical emergency. They must be checked out. Double vision isn't quite such an emergency, in other words, not off you go on the spot, but it should definitely be seen urgently.